or hearing implants. They are implants, the ones that they can put in inclusive management. How do we manage them? How do we manage them? Visual teaching aids and written instructions. Visual teaching aids and written instructions. Strategic teaching arrangement to enhance lip reading. I talked to you about Iman, that she read my lips. You have to strategically place such children in the class so much so that they can be, you can quickly communicate with them. They can read your lips. Collaboration with audiologists and speech therapists. They have to work with audiologists and speech therapists to keep such children in school. Now, the next one, visual impairment. I'm trying quickly because, yes, of Dr. Ojo. Visual impairment, definition, what is visual impairment? Or complete loss of vision. Some people are partially blind, or some people have lost their vision completely, affecting the ability to read, navigate, or participate fully in learning activities. If you look at some of the pictures of our students that went for their internship at the Lagos State Suburb School, you will see that some of the children have visual impairments. Yes. Some of them were looking at things like this. Okay. Now, inherited conditions, or most of the time, visual impairments are inherited issues. They run in families. Most of the time, they run in families, or developmental issues. Acquired factors include injuries, infections during pregnancy. Let me say that 60% of problems children have when they come to this world are initiated during pregnancy. Infections during pregnancy. When women are pregnant, our biological build-up is like broken down. Our immunity is weak because what you have, your immune system that is serving only you, is now serving 2 or more people. So it's not sufficient. So you are prone to malaria. You are prone to, if you drink the wrong water, you can start having diarrhea or something. Now, a lot of pregnant women go on with untreated malaria. Or let me say, uncured malaria. They don't cure the malaria. They're just using something to suppress it. And they end up having jaundice. That is why so many children, when they come, say, hey, when jaundice, the eyes is yellow. It is from the mother. Jaundice does not go from tree to enter children. It is from the mother. Once you see a child that has jaundice, the mother did not treat an infection very well. It could even be a toilet infection. It could be a toilet infection. When I was having my children, it happened during my first child and my second child. From that one, I've learned. It didn't happen in my other children. I can't use any public toilets if I'm pregnant. No matter how clean that toilet is, if I use it, it is that very day the infection will start. And I will have very bad infection. I mean very bad. The type of infection that when I'm walking, I'll be walking like this. I'll not be able to put on pants. So, but luckily for me, my immediate senior sister is a matron. So she was able to educate me that, see, this thing, if you don't use the right medications and cure it, it can affect your child's eye. Because everything going into your inside is going to that child. Especially during the 3rd trimester, when the head has come down. Everything is going there. So it could go into his nose, it could go into the eyes and everything. You can have a child that will come and we start having eye problems. So many of the things we see children present, parents talk about when children have come, they are not any arrow. Please stop that thing. If you are one of those people that used to say, they shot him an arrow, they shot that arrow, there's no arrow anywhere. Oh. There's nothing like arrow. There is a genetic factor that is causing problem. There are people who are not supposed to marry each other because of their genetic makeup that are married. Resource negative that you are hearing is just one of the problems. There are so many other problems that thing can cause. Some people are having continuous, Mr. Lighton, something is happening here. Some people are having continuous miscarriage because their blood and that person's blood cannot, it's not working. It's like too negative. It's not working. It's not working. It's not working. And in situations like that, there is nothing you can do than for the couples to separate. But you know, this thing is about love. It's emotion. Where will I start from? Who will he? At my age. If my daddy is my daddy's friend's son. At the detriment of your life and your peace of mind. That is why the moment some women step into marriage, they have sold their peace. They no longer have peace. They no longer have peace. If I have with pregnancy, which if I have with pregnancy, which if which if who is there? Who do they call if? So poverty is another thing that causes this problem. So when you know all these reasons, like I've known, you'll be able to move away from the school of thought of is arrow. They shot an arrow. It's arrow. It's not any arrow. It's not any arrow. There's chair. There's chair here. Do you understand now? Now, medical conditions, untreated cataracts or glaucoma. Signs and symptoms. Difficulty. Yes. I'll soon be done. They will go and join Dr. Ojo. I'm going to continue with this today again in the evening, online. That's the agreement we had for special needs, that we will continue Friday and Saturday physical. That's what we are doing now. This evening we are going to do, I'm going to drop a video, and tomorrow I'm going to drop another video. Because why am I doing this? I am even going to be sharing this with our students that are graduating. With the children that are coming in here for assessment. Now, I see that teachers lack a lot of information. Teachers lack a lot of information. A lot of information needs to go out there. People need to know. People need to know, because lack of knowledge is causing a lot of problem. So I don't want to do that. I will explain that in my next video. Difficulty reading standard print materials. You see 3-year-old going as close as this to the board. I went to a school, I saw a 3-year-old. His glasses is 2 times thicker than my own. 3-year-old. I looked at the child like this, 3-year-old. I was asking my friend that we went there together, I said, what will be the condition of this boy's eyes when he's 30? If at 3, his eyes are as bad as this, it's genetics. It's genetics, so. Ọmọ yẹn ò ṣayé wá, òbí ló ṣìyàn. He didn't come to the wrong world. He came through the wrong parents. He came through the wrong parents. Many children come through the wrong parents. So that is why when you see them, they have these developmental disabilities, delays, neurodivergent brains. You need to show empathy. I can never beat a child with special needs. I can never. Because I have too much information in me to know that it is not this child's fault. Every mistake in a child is the error of an adult. People who are not supposed to toy with pregnancy that toyed with it. People who are not supposed to marry each other that married each other. People who married each other who refused to do the right things when they were getting pregnant. People who still get pregnant, have this child, refuse to do early intervention even after they've seen problem. They can't pay for therapy, they can't go for test, they can't do this. Anything you ask them to do, they can't do. They just wish magic happened to the child. Unfortunately, the next place that child will land is in the school. It's in the school. And some school owners will accept those children because they are looking for growth. You go accept the problem. Somebody will be bringing problem like this. Oh, you are bringing, come my house. At schools, you should have information and know where to draw the line. This one, no, we can't deal with this type of problem. This is not for us. Every developmental disability has mild, average, and severe. The moment it goes after mild, it's not your business, except you are running a full-fledged special needs school. Even special needs schools reject some children. Unfortunately, Mrs. Kotila is not here. The school my students were going for internship before we started using Lagos State. I prepare their mind when they are going. They are going to that place. If you know you cry, hold very big towel. Yes, you are going to see. I have students who went who couldn't go for more than 2 days. They dropped. They said they can't continue. Yes, they can't. They said they can't continue because of the type of children they see. Say no, I can't continue seeing that thing. No. They don't even know that people like that exist. Increased reliance on tactile and auditory information. They have to now rely on braille or what you tell them because they are visually impaired. What are the early interventions, screenings, regular vision examination? There is a girl that passed out with my last son in secondary school. Raman, you took that child. When I was running a crèche here, that year, when they gave birth to this girl has this white something in her eyes, like this glaucoma something. Young couple, oh, she's their second daughter. Young couple, they just have one, and that small girl. Somebody said they should go and put snail water. Snail water. Instead of taking this girl to the hospital, that they should put snail water. That's how that girl lost that eye. She's in LASU now. She and my last born, they passed out of secondary school. They were classmates till they passed out. I saw her on her graduation day. I saw the parents. That's how they lost that eye. Snail water. Educated people, both couple, the mother and the father passed out from LASU. They are graduates. See how stupid information people. See the extent people can go to destroy things. Snail water. Now, corrective measures, provision of glasses, magnifiers or low vision aids, orientation training, mobility and orientation program to build independence, inclusive management, provision of large print materials and high contrast visuals, use of audio resources and tactile learning aids, classroom arrangement that maximize access to visual supports. Nursing care students, you can go to Dr. Ojo. I'm going to continue this video, so you continue to watch this online when you are done. You understand? Go to Dr. Ojo. I'm going to continue with these people and finish it. No, she's staying here. She's staying here. Please go quick, so that we can. I'm going to continue. You want to stop? Don't stop it. I want to finish. Huh? Yes. So these people will get it online. I'll just make sure I finish this one. Can I have one house? Huh? No problem. Or you use this one for Dr. Uju because I started here and a lot of students are here.
Yes, that Facebook.
A lot of students are here. Huh?
That Facebook makes sense because I was there.
You see?
And it was very clear.
You see? Go and use that one for Dr. Uju. Go and use that one for Dr. Uju and put it on Facebook. Don't worry, we'll talk about it when you are done. Then recharge. Where's my phone? Recharge.
I joined.